Okay, so here is my um, reflection on delivering multiples in the home birth setting. I am not part of a birth center, and the only birth center close to me is about 2 hours away, almost 3 hours actually, away from me. So I've never attended any multiples there either. Our practice, since I've been there since 2020, and we have only had one twin mom, and she actually ended up transferring in labor. I was not at the labor, so I have palpated a couple like of her. I have palpated her abdomen in a couple prenatal appointments, but I've never actually attended a birth of multiples. So, um, my knowledge base and feeling comfortable at a multiple delivery is pretty much zero. I don't think it's something that I would feel comfortable with because I don't have the knowledge or skill base for it yet. Even if I did get that knowledge or skill base for it, I'm not sure it is something that I would want to have in my own practice. It seems like a huge thing to take under kind of your wing. So I just don't know if I would ever feel comfortable with that. And if I were to ever attend a multiple birth of multiples, I would want to have years and years of experience attending as an assistant before I ever even like dabbled in doing primary. I think that is a lot. So my overall thoughts of this as a student is that I would not do it. I think that there's too many risk factors and too many complications that can kind of come up. So risk factors include things as hemorrhage, preeclampsia, increased risk for gestational diabetes, a preterm birth, malpresentation, selective fetal growth restriction, placenta previa. There's so many things that can that put these individuals at risk, and at that point we would have to transfer out of care anyway. So these are just things that are on my mind. Like, you're really heightened for, is any of this developing, and do we need to get a hold of this quickly before like you don't ever want to miss something, obviously. So with a twin delivery, all these risk factors are just increased. Considerations that I would want to really focus on would be types of twins. Is this a di-di, mono-mono, mono-di situation? What is the biggest risk? Is mono-mono, so that would be completely out of our scope. Di-di, from my understanding in Connecticut, is the only twin delivery that the midwives will do. And even then, not all the home birth midwives choose to do it. Presentation of the twins is, are they transverse? Are they breech? Are they one's down and one's up type of thing? So that would be something really big on my mind, even as I'm assisting, to figure out what is going on. Is this next baby going to be breech? Is this next baby going to be head down? I think it's important to know all these things. And then another consideration that's really on my mind during delivery of multiples is, where's the nearest hospital? We live in the country. Most hospitals, well, I should say, we have one local hospital that is very small and does not have a NICU. The bigger hospitals that handle more of these complications are within 45 minutes to an hour from us. So that is something that's really on my mind. Our fire department is 10 minutes away from here. In addition to that, it's all volunteers, so you're waiting for a volunteer to get to the fire department to get the ambulance to get here to take them then to the hospital. So it's a really big consideration around here that it's, you're not 5 minutes from the hospital. You're not 2 minutes from the hospital. You are 20 minutes from getting an ambulance to your house, and then you're almost 45 minutes to an hour from a hospital with a NICU, or to be life flighted by helicopter, which happens very often around here. So that's a huge thing that I consider when taking on a delivery of multiples. And then another thing that I would really, really think about is, how many people do I have present? How many people in the birth can help me? Is there doulas? Is grandma there? Is there a partner there? Are there siblings there? Who can call 911 for me? Who can help me in any type of situation? That's always really on my mind too. And then do we have double of everything? How's our equipment? Do we need multiple ambu bags? Do we need multiple stethoscopes? Do we have 2 people to be on babies when they come out? Do you have 4 people to be on baby? Because if there's a resuscitation, 2 people is better than 1. So that'd be 2 and 2 for each baby. So these are all things that are right in the forefront of my brain. And then my comfort level, I've already kind of shared. I'm not comfortable attending or being primary, even primary under supervision, a twin delivery. And I also think that there's a level of emotional connection to being a midwife. And when we say we are comfortable, it's not just like the skills, our hands, our stethoscopes. Are we skilled enough to deliver this baby? It's what's the emotional ramification if there is a trauma on our personal emotional self. Hold on one second. Sorry. There is a huge undertaking emotionally that we have to pay big attention to and not to traumatize ourselves. And for me, I feel like if something went wrong, I would be setting myself up for more trauma. So that's something that's really big on my mind. As far as Connecticut, we do not have any legal standards. We don't have any guidelines. There's no licensing under us. Midwives in Connecticut, there are some practices that do multiples, but it's not all of us. And there's no like community standard where we all got together and said, we're not doing this. It's really chosen from practice to practice. And then some of the evidence that I've gathered, I will post in my outline. Early identification of risk factors. I think it's important to have the conversation with our clients of like, hey, you are at a risk factor because you're pregnant with multiples, and are you willing to go and get more tests? I think that's a huge one. Oftentimes people are coming to us because they want to limit interventions, and with a multiple delivery, we actually probably will have a little bit more, not interventions, but like screenings in the prenatal setting. So are they going to be okay getting more lab work done? Are they going to be okay getting more ultrasounds? Are they going to be okay working with maternal fetal medicine and us? These are all questions to ask. And then one of the things that I also is on my mind is midwives, are they feeling comfortable in breech delivery? Not everyone is trained in breech delivery, and so that is something on my mind. I am not, so again, that's not something that I would feel comfortable with. Baby A might come out head down, but baby B might be breech, which it increases other risk factors. And then some of the evidence that I found showed that with a very small study of 100 people, showed that they had actually better outcomes with vaginal deliveries than with, they had better outcomes. Like they took 100 people and there was a higher, losing my train of thought. There was a higher percentage of vaginal deliveries than C-sections in that specific case. But again, it's a very, very small case study. And I would be very interested in seeing a very large case study for that information, because I think that, how many of those people got transferred out of care? There's 100 people in this study, but was there 500 people to start with, and more people transferred out because of these risk factors? So these are all things that are on my mind.